Joe Rogan, the man with the largest and most influential podcast, recently disclosed that he tested positive for coronavirus. What caught everyone's attention about the COVID announcement was what he was doing to self medicate following months of rants against coronavirus mandates, against mask mandates. So let's watch the video he posted on social media explaining what he was doing to treat himself.
Got tested, and turns out I got COVID. So we immediately threw the kitchen sink at it. All kinds of meds, monoclonal antibodies, ivermectin, Z-Pak, prednisone, everything.
Prednisone, Z-Pak, ivermectin. The thing about ivermectin, which is meant to treat people who are suffering from a parasitic infection in their intestinal tract, is that most people pushing it don't actually take it. But Joe Rogan somehow was convinced that ivermectin would be a treatment for coronavirus, even though there is no scientific evidence indicating that that's the case. But Rogan, who's again openly against vaccine mandates, genuinely believed that healthy Americans didn't even need the coronavirus vaccine. In a previous episode of his podcast, he said, quote, "I'm not an anti-vax person. In fact, I said I believe they're safe and I encourage many people to take them. I just said, I don't think that if you're young, healthy, a young or healthy person, that you need it." Now, he did receive a lot of backlash for it. So he walked the comment back a little bit saying, quote, "I'm not a doctor. I'm an effing moron. And I'm a cage fighting commentator who's a dirty stand-up comedian. I'm not a respected source of information, even for me." But the problem is, whether Rogan likes it or not, for a lot of people, he actually is a respected source of information. So he has a little bit of a responsibility to dig in to claims that something that's meant to treat parasitic infections could somehow help someone who's suffering from a highly contagious virus that impacts their respiratory system. But nonetheless, there was another shocking ivermectin related story this week, and it had to do with a judge in Ohio who ordered a hospital to administer the dewormer to treat a hospitalized coronavirus patient. Now, the drug, again, which is commonly used for parasitic infections in livestock and sometimes in humans, has not been proven to treat or prevent COVID-19, which made this ruling so shocking. Now, Judge Gregory Howard wrote that doctors treating 51-year-old Jeffrey Smith shall immediately administer ivermectin to Smith, according to court documents. Smith will receive 30 milligrams of the drug for 3 weeks. Now, look, it's unclear if Smith was vaccinated, but I'm going to take the liberty of speculating that it's highly unlikely because if you did get the coronavirus vaccine, the likelihood of you being hospitalized is incredibly rare. It's minimized to a great extent. And same goes for dying from coronavirus. You might get a little sick. Some people might even have some moderate symptoms. But the whole point of the vaccine is to prevent you from getting deathly sick. Now, Smith tested positive for COVID-19 on July 9th, and then he was hospitalized and admitted to the ICU on July 15th. He was put on the hospital's COVID-19 protocol of the antiviral drug remdesivir, along with plasma and steroids. On July 27th, after a period of relative stability, Jeffrey Smith's condition began to decline. He was sedated and intubated and placed on a ventilator on August 1st. He later developed a secondary infection he was still wrestling with as of August 23rd. Now, they had put him in a medically induced coma. It was obviously, not a great situation, but he apparently woke up from the coma and ripped his tube out, and that led to an infection, which is why his situation started to decline even further. And, his wife and his partner, his caretaker, became incredibly desperate for a solution. So his wife, Julie, began looking for other treatment options, started Googling, and ran into, a website that said that ivermectin's a great option. So Julie Smith found ivermectin on her own and connected with Dr. Fred Wagshul, an Ohio physician who her lawsuit identifies as one of the foremost experts on using ivermectin in treating COVID-19. He prescribed the drug and the hospital refused to administer it. Now, the reason why the hospital refused to administer it is because the hospital has an ethical concern in administering a prescription drug for something that it does not actually treat. So that's the reason why Smith's wife, Julie, went to court to essentially force the hospital to administer the drug. And since the judge was able to see that there was a prescription for the drug, he had no choice but to force the hospital, I guess, to administer it. Although there are some legal experts who debate that. They argue that the hospital should have the ability and does have the ability to reject using that type of drug on a patient, that they have an ethical duty to do so. But since I'm not a legal expert, I'm not going to weigh in on that. The real question is, where did this drug come from? Why is it being pushed as a treatment for coronavirus when there is a free and approved vaccine available that prevents people from getting incredibly sick, hospitalized, and dying from COVID? Well, it's fascinating because there's a lot of studies. There is one main study, a meta-analysis of smaller studies indicating that ivermectin is actually effective. That's what gets cited by the very individuals who are pushing it. However, the co-author for that meta-analysis, his name is Dr. Andrew Hill, I should say, says that you should probably stop citing the meta-analysis because it has been withdrawn. Our meta-analysis of survival for ivermectin, he writes on Twitter, had to be retracted after one of the main studies was suspected of medical fraud. With the revised version, there is no statistically significant survival benefit for ivermectin, so the original version should not be quoted. Also, every major health-related government agency has cautioned people against using ivermectin as a treatment or a prophylactic for coronavirus, including the FDA, the CDC, and the NIH. So why would a pulmonary doctor like Dr. Wagshul, who prescribed Jeffrey Smith that ivermectin prescription, do so when there is no evidence indicating that it's a treatment for COVID? Well, I looked into this doctor's history and what he's been up to since the coronavirus pandemic began. And the Ohio lawsuit makes reference to the Frontline COVID-19 Critical Care Alliance, a nonprofit of which Wagshul is listed as a founding physician. The organization touts ivermectin as a preventative and treatment for COVID-19. Its How to Get Ivermectin section includes prices and locations of pharmacies that will supply it from Afghanistan to Fort Lauderdale to Pennsylvania to Sao Paulo, Brazil. So what I started to realize was that there is, in fact, a profit motive behind pushing ivermectin. Because one thing that we keep hearing from those who are skeptical about the vaccine is that it's being pushed by big pharma. There's a lot of distrust in our institutions, and I believe that that distrust is not misplaced, I should say. I think that that distrust makes a lot of sense, especially as Americans have experienced decades of pharmaceutical companies essentially gouging them for the drugs that they need to survive or to treat their illnesses. So what I also noticed, though, is that some profit-driven individuals and organizations have seen an opportunity to exploit the distrust that Americans have in institutions to essentially push for a drug that not only is ineffective in treating COVID, but will turn them a quick profit if they create a little business model around it that makes a lot of sense. So that's the point of this decode. That is the case that I'm trying to make here. And I'm going to provide some evidence for why I believe this is what's happening. Because again, where did a horse dewormer come from as a COVID treatment? It seems kind of weird, doesn't it? Now, the organization that Dr. Wagshul started in the midst of this pandemic sounds a lot like America's Frontline doctors. That's a pretty controversial group of alleged doctors who have been pushing for all sorts of insane things. But really, the emergence of America's Frontline doctors was all about initially defending Donald Trump and his response to the pandemic, and then it morphed into something else. So, as Time writes, the emergence of America's Frontline Doctors was the brainchild of the Council for National Policy, a secretive network of conservative activists. During a May 11th, 2020 call, CNP members complained that Trump was being slammed for his handling of the pandemic, including failing to follow scientific guidelines. The group needed their own medical professionals to promote their message, they said, in the face of data showing 2/3 of Americans were wary of restarting the economy. Remember, in the beginning of the pandemic, the government shut businesses down in order to slow the spread of the coronavirus. But about 2 weeks after that shutdown, corporations were incredibly antsy, wanted to open businesses back up immediately. Even politicians like Texas's Lieutenant Governor Dan Patrick was incredibly transparent in whining about how these shutdowns were hurting the markets. I mean, poor Lieutenant Governor, worried about his stock portfolios. So initially, America's Frontline Doctors were looking out for corporate interests and defending Donald Trump as he was trying to convince the American people that it was time to prematurely reopen the government. Now, soon, America's Frontline Doctors went from pushing premature reopenings as COVID numbers were still spiking early on in the pandemic to pushing for the use of an unproven drug like hydroxychloroquine.
You don't need mask. There is a cure. I know they don't want to open schools. No, you don't need people to be locked down. There is prevention and there is a cure.
Now, that was also the doctor who was warning everyone about demon semen or something like that. I mean, just complete wackadoo stuff. Okay. But obviously, hydroxychloroquine not only failed to save as a cure for COVID, it also had serious side effects for people who decided to use it as an unproven treatment.
The World Health Organization has suspended a clinical trial of the anti-malaria drug hydroxychloroquine as a COVID-19 treatment. It cited safety concerns. US President Donald Trump said recently he was taking the drug, but has since stopped. The WHO and health authorities around the world have warned of the drug's potentially dangerous side effects. There's also no definitive proof that it is effective against the coronavirus.
Virtually all of these drugs that are being considered and being used have the potential to prolong the heart's QT interval, and in doing so increases the patient's chance for the heart to spin electrically out of control into a potentially dangerous heart rhythm. And if that doesn't revert back to normal, then that patient will go on to experience drug-induced sudden cardiac arrest and worse.
But America's Frontline Doctors, decided to push for the drug anyway, and they did so while Donald Trump was publicizing the drug and claiming he himself was taking it, although I personally don't believe that he was. Now, there were also trials on hydroxychloroquine in Brazil, but those trials came to a halt after the side effects became incredibly dangerous. Coronavirus patients taking a higher dose of chloroquine developed irregular heart rates that increased their risk of a potentially fatal heart arrhythmia. Roughly half of the study participants were given a low dose of chloroquine, while the rest were prescribed a high dose. Within 3 days, researchers started noticing heart arrhythmias in patients taking the higher dose. By the 6th day of treatment, 11 patients had died, leading to an immediate end to the high dose segment of the trial. And other trials indicated that hydroxychloroquine did not either prevent coronavirus, nor did it help to cure coronavirus or treat coronavirus once a patient had it. Now, again, I really want to reiterate that this pandemic has crystallized just how little faith Americans have in its institutions. So when the coronavirus vaccine was made widely available, many people, like Joe Rogan, just didn't seem to trust it.
But what you continue to hear is this prevailing lack of trust in the government. This isn't just a 2021 thing or a coronavirus vaccine thing, but this is a mounting, ever-growing distrust in the government at large.
Oh, I've heard quite a few people say they're not going to get it. They're afraid to put things in their body. They're afraid they're going to get something from it. They're afraid that I don't know. I haven't heard any good reason why people aren't going to get it.
All you got to do is go to Facebook, and you'll get bombarded with the people thinking that the vaccine is going to kill them.
I don't care if I look like the wise guy or the dumb guy. It's my decision. I just decided I'm not going to do it. I'm a guinea pig if that's the case.
Yeah, I'm not going to get the COVID vaccine. I don't feel like I don't know. I just feel like I'm good. I don't need to. I take vitamins and whatnot, and I'm pretty healthy, so.
Now, unfortunately, those looking to make a quick buck decided to exploit the lack of trust Americans have in our government. And now America's frontline doctors are finding ways to cash in on ivermectin, and they're doing it pretty easily. So for those who say, no, ivermectin, you can get the generic version. It's a cheap cure, and it's like sticking it to big pharma. Fact of the matter is that is not what's really happening here. There are certainly profit motives behind the people pushing for ivermectin. And remember, the coronavirus vaccine is free. Now, there needs to be more protections for workers. So if they do, in fact, get the vaccine and they feel sick and need to call out the next day, they don't face any retaliation from their employers. But in terms of the cost benefit analysis and which option saves the most money, it would certainly be people going in to get a free vaccine. Now, how the hell is America's frontline doctors making money off of ivermectin? Well, there's one obvious way. So on its website, people looking for COVID-19 medicine are told to click on a button labeled Contact a Physician, and then they pay a $90 consultation fee. The link takes customers to another website, Speak with an MD, where they're asked to submit payment information and told that one of the frontline doctors will call them within a few days, with sick patients being prioritized. The group describes Speak with an MD as a telemedicine service with hundreds of America's frontline doctors, physicians, basically, physicians within this organization. So what happened in the beginning of the pandemic is the Trump administration loosened federal regulations pertaining to telemedicine and allowed for Medicare recipients to do telemedicine, which, by the way, made a lot of sense, right? It's a pandemic. People might want to see a doctor from the comfort of their own homes. That's totally understandable. But with the loosened laws on telemedicine and the profit motive behind groups like America's Frontline Doctors, you kind of have a recipe for pretty terrible exploitation. So the thing is, people could just go straight to the Speak with an MD website. And instead of getting redirected by America's Frontline Doctors, they could just go straight to the website and they would pay a fee, but the fee would be less than the $90 that's being charged by America's Frontline Doctors. The service is marketed on AFLD's, America's Frontline Doctors site, for $90, while a direct telemedicine consultation through Speak with an MD is listed at $59.99, a $30 difference. So right there, right off the bat, they're making $30 every time someone goes to their website, and that person then gets redirected to a website they could have gone to directly themselves. So the grift is pretty clear there, but it goes even further. They find other ways to make money off of exploiting people's fears and distrust toward our institutions. So the founder, Simone, was actually arrested for participating in the January 6th insurrection, emails to supporters requesting their urgent and generous donations to withstand such aggressive assaults from the ruthless enemies of free speech, raised more than $400,000 for Gold's legal defense. America's Frontline Doctors built a slick website whose domain was bought by the Tea Party patriots and an email list of loyal followers whom they urged to make donations. So they actually have people donating to them because they position themselves as like these brave warriors who are looking out for the best interests of Americans, right? So people donate money to them on a monthly basis. They'll donate money if there's a cause that's being advertised by this group. In this case, it's the legal defense for Simone Gold. And Gold even sells insanely pricey tickets to meet her in person, like she's some sort of celebrity. In the spring of 2021, for instance, the group announced a national RV tour, which sold VIP tickets for a meet and greet with Gold for $1,000. And the grift doesn't just end with America's frontline doctors. As I mentioned, these loosened telehealth restrictions or regulations has led to a chain of bad actors who engage in this type of behavior. So, for instance, this chain doesn't just end with America's frontline doctors and Ask an MD. The actual Speak with an MD service is OnCore Telemedicine, a company that connects patients to teledoctors willing to write prescriptions. Since 2015, it appears to have been run out of a home by a golf club in suburban Georgia, according to its business registration. The orders made through OnCore Telemedicine go to Ravku, a digital pharmacy in Florida whose address listed online appears to be a dilapidated white structure by a strip mall. Honestly, this sounds a lot like the pill mills that were putting out opioids and certainly did contribute to the opioid epidemic that we're still dealing with, by the way. It's just completely ignored and not talked about. And it's incredibly frustrating. But Ravku is supposed to either mail the medicine or call it into a local pharmacy. Now get this, the cost of the medicine is applied on top of the consultation fee and varies widely from $70 to $700, according to America's frontline doctors' customers. They've been, commenting about this on social media, and Time went out of its way to find those comments and read those testimonials to see what's really going on here. Now, again, the coronavirus vaccine is free. You don't have to pay for a consultation fee. You don't have to pay for the vaccine itself. You just go into any place that's offering the vaccine, whether it be a CVS, Rite Aid, Walgreens, whatever it may be. There are some mobile efforts in rural parts of the country as well, and you just get the vaccine for free. But there's less of a profit motive for the organizations that are putting out these claims about ivermectin or hydroxychloroquine. In fact, those organizations don't make any money at all, which is why they keep pushing these baseless claims that ivermectin is an effective treatment for COVID. Now, the consequences of pushing this snake oil obviously go further than robbing people of money. It could also rob them of their lives. So, for instance, one case involved an adult drinking an injectable ivermectin formulation intended for cattle and becoming hospitalized for 9 days with confusion, drowsiness, hallucinations, rapid breathing, and tremors. Another person bought ivermectin of unknown strength from the internet, took it 5 times a day for 5 days, and presented to the hospital disoriented and unable to answer questions or follow commands. The symptoms improved after they discontinued use. So look, I think the solution to this is maybe not so easy. We've certainly experienced how difficult it's been, but if we really wanted to fight for a solution, that solution would be a single-payer healthcare system like Medicare for All. It would be a healthcare system that actually builds trust among Americans rather than essentially sow doubt and complete distrust toward our institutions. Again, I mean, the pharmaceutical companies have been the boogeymen in so many tragedies in our recent history, right? I mean, when you think about the opioid epidemic and the role that they played, it's so many of these people are, of course, still dealing with that. And so if you're distrustful toward pharmaceutical companies, and then you have a government that's kind of neglected your own economic situation, are you likely to trust the very people and the very organizations and institutions that have screwed you over in the past? No, not likely. But if you have a single-payer healthcare system that actually provides the care that Americans need at the point of service, I would argue that distrust would be less of an issue. So federal authorities, by the way, in the short term have sent some strongly worded letters. They are cracking down on coronavirus-related telemedicine schemes. The Federal Trade Commission has sent nearly 400 warning letters to groups and individuals marketing false COVID-19 treatments, including one missive in April telling a Texas medical practice to immediately cease promoting ivermectin or face steep fines. But that response, again, clearly fails to address the root of the problem here. And again, the only thing that I can see that would address the root of the problem is making sure that we fight hard and pass a single payer healthcare system similar to the one that Bernie Sanders has been fighting for quite some time now. Paul.
Yeah, that trust piece is so key. And I think we got to talk about that more when we're talking about single payer. And this is something I've heard, and, not to overglorify everything's going to have its issues, but about the NHS in the UK or even Cuba's healthcare system is it's not just that they get, healthcare for free, but it's like there is this long-term relationship between patients and their doctors in the hospitals. I think in the NHS in Cuba, a lot, they do house visits. So imagine, if we had a program where our medical, we had a national health service that was doing house visits, canvassing people about the vaccine, I think that would go a long way. Or just the fact that people have this trust, built up over time, would do a lot. And, still with all of that, and like you said, like I totally understand, if you are critical of the government, of authority, that's great. But what I still struggle to understand is like, if you're going to be critical of that, why aren't you just as skeptical as like any random thing you see on the internet, So that's just, I'm still frustrated by that. I just sometimes still don't get it. It's like, just apply that same skepticism to everything you see. And it doesn't seem like you're doing that to these same random ass websites that you might be coming across.
Yeah, I've been incredibly frustrated about that too. But the way that I mean, if you see the way that they frame their argument while they're pushing the snake oil, they frame it as, this tyrannical government is trying to, go after you. And, they're going to, the conspiracy theories are there, but they play into, I just feel like a lot of people are primed, right? They're ready to like kind of buy into that kind of framing. And it's not without reason. Like, I'm not like trying to make them out to be like, irrational, illogical people. It's because of the bad experiences they've had in the past. And my point is, you need to build that trust. And, you mentioned the house visits. At first, I thought that was a great idea, but then I started realizing that a bunch of conservatives were like threatening to shoot anyone who shows up to their house. And it's because that distrust, it runs so deep. And you've got to like build that trust, right? I think that a single payer healthcare system can, start to do that. And you mentioned Cuba. One of the reasons why Cuba's healthcare is actually pretty great, even though they have such limited resources, is because they focus heavily on preventative measures. So they do house calls and they take every ailment seriously early on to prevent someone from getting incredibly ill.
Right.
Incredibly sick. Yeah. It's the antithesis of what we do.
Yeah. And, and one more thing on the trusting, what's so interesting, and I've had this conversation a lot, and I will say very genuine question, like, what, for the vaccines that are already in your body, whether that's polio, smallpox, is it that you think those are fine and there's something uniquely bad about this one? And oftentimes they'll say yes. And it's, I think this idea that, well, the government used to be good or fine or wasn't diabolically evil, but somehow something is different about today where you think that they are. And this vaccine is different than the other ones, which is just interesting. I don't know how ultimately to get past that in a short-term way. And unfortunately, we don't get past it in a short-term way. The COVID and whatever variants come up next are going to be also worse in the short term.
If you enjoyed this video from Jacobin Weekends, please hit like and subscribe. That way, you'll enjoy all of our backlog, as well as all of our future content, including interviews, live streams, and clips. Thank you.